A local business in town is Dr. Anita Wong's practice, and she practices wellness, and we're here each and every Monday talking about wellness. And I want to make this very clear. We're going to be taking some questions from listeners that you've submitted on the Text Connect. Though she is an MD, though she's one of my most trusted scientists, we do advise that no matter what you hear from her in these answers, you can check it out with your own doctor as well. Just to be safe, just to be sure, and that's my disclaimer. This is Dr. Anita Wong has no opportunity to examine you for questions that you simply ask on the radio. So granted, it's very general there. But the stuff that we're talking about today, I cannot believe it. So first of all, good morning, Dr. Wong. How are you today?
I am wonderful. Good morning. I'm glad to be here.
I'm glad to have you here. So the subject matter, and I'll get to the listener questions a little bit later on in the conversation. But you sent me a note that I found fascinating in that we start losing our muscle mass. Most of us start losing our muscle mass in our 30s.
Yeah, that's when it starts. I mean, you have to think about this. You know, growth and development only goes so far, right? And then if you follow the adage of conventional medicine, it's you're born, you're vital, and you decline. So when does that happen? So that happens starting in your late 20s. Well, actually, when you're 18, you start losing collagen 1% per year. So if you have a lower base of collagen, you see wrinkles sooner. So darker skin see wrinkles later. So that's the difference. So muscle mass, you start losing some of that in your 30s. But the majority of it, where you're going to lose that muscle mass, is more in the decades of between 50 to 70, where people will lose 30% of what they're going to lose. So, but over the course of if you do nothing, you can lose 15% of your muscle mass by the time you're 65, if you're not doing weight training, keeping it up, doing anything to maintain.
Okay, so I hate to think that I peaked at 18. And through my 30s, I worked out daily a lot and played sports and all of that. And even into my 40s, kept up with as much of that as I could. The percentage of muscle mass that we need, by the time we're 65, is 15% the right number? Am I thinking of that?
Right, yeah, it's roughly 15% that you can lose up to.
Okay.
Or more. I mean, everyone's different, but roughly around 15% of your muscle mass.
So if I worked out into my 40s and into my 50s, is that percentage lower at 65?
Yes, yeah. So you want to maintain muscle mass. That's the whole thing. So when people say, "Oh, I don't know what happened. I turned 40 and it just seems like if I eat anything, it goes to my hip, or or I just got this belly, or anything. I can't manage my weight." Well, your resting metabolic rate has lowered because you've lost your muscle mass. Right? So if you lost some of your muscle mass and that you didn't maintain it, then you lost that little edge where you could eat a bunch, and when you're young and growing, you could eat whatever, and it just didn't seem to go anywhere. You didn't gain that buttery outer coating, right? But then all of a sudden now you said, I just smell that cinnamon bun and I got a buttery outer coating, right? So that you just have to maintain and keep up. So that's why movement is one of my 4 pillars, and movement is key. And in there's got to be, then that's why we talk about strength, power and strength training, and eating enough protein. That's where this big fad right now is eating a lot of protein, because you want to maintain your muscle mass. But I think you should just, check the amino acids, make sure what you're taking, make sure that you're getting the right amount. You don't want to overdo it, because overdoing it can be a problem also.
When you say movement, does it have to be like a hard cardio workout, of jogging or running type of thing? Or can movement be something like Tai Chi, or does it have to be a cardio type of movement?
So movement, actually there are some people that do I forget the acronym now, but it's called, they monitor this, non-exercise, movement. So people who tend to fidget, people who tend to just move throughout the day, where you get your 10,000 steps, right? So just walking and just moving your body, because they did this study on the natives in Africa, and they monitor them to see about that. They don't have a lot of overweight there. They're not industrialized, and they didn't have the high calorie count what we're doing. But they were just checking about movement, and actually they rested about 10 hours a day, but they were constantly moving, right? So you get up in the morning, you got to tend to the sheep or the goats or whatever it is, right? And then you're moving, getting them around. Then you got to go pick up the kindling. Then you set the fire. Then you stoop there to get the fire going. Then you go get more kindling. So there's constant moving. Then you got to go get the water. But they're always resting in between. And that was the one thing I noticed in Africa. I said, why is everybody just sitting around? They just seem to be sitting around, but they're very active, so they're conserving their energy. So you could be one of those people who don't like to exercise and you don't get the endorphin rush. So you just want to move your body, go out, work on your garden, go clean your house, mop the floors. Any of these kinds of activity, movement is great, because that can count as an exercise. But when we're speaking specifically about cardiac, there's going to be cardiac exercise, then there's going to be muscle, right, exercise that you're going to do. So it's a differentiation. But if you're someone who doesn't like to exercise, but you work in the home, so you lift a pot that's heavy, you can lift it several times for the biceps. You can do certain movements that can help.
What is it about working out that is so addictive? I find that I can't not work out. I can't not do my lunges, whatever it is that I'm hooked on for that month or whatever. What is it that's so addictive about working out?
Well, you're getting a chemical release. There are some people who do not get that, but you're releasing a chemical. You're getting the endorphin rush that we call it. That gives you that little high. So that people call it the runner's high, or whatever it is, whatever you're doing. So you're just getting that euphorism from that.
So that's my hook right
there.
That
yeah, it's addictive.
Yes, it is. And if I may, I'll talk about your weekend a little bit. You sail, and you sail competitively.
Yes.
And that's a form of exercise, I imagine, because you got to twist for the mast. There's all kinds of exercise involved with that.
Yeah. So I like those days. So Saturday, we were not that successful, and it was foggy initially, so it was delayed a little bit, and then we didn't do so well. So when it's like I don't know what they call it, hours of boredom and then 10 seconds of terror, right? So we had a lot of little mishaps. So our spinnaker twisted, and so we had to get that untwisted. So there's grinding, there's pulling, working on there. So there was a lot of movement going on, and we had 4 races that day. So a lot of little complications. So a lot of movement. Now yesterday, it was like a lake out there. There was no movement, and put up the spinnaker, and was a lot of just sitting and meditating and just sitting. So one day was exercise, the other day was I was getting my parasympathetics in balance.
If we develop the proper amount of muscle mass early in life, can we burn calories later in life just sitting on the couch?
Absolutely. That's exactly what I plan to do.
Okay. Okay.
So I try to keep up my muscle mass so that I am just burning the calories, right? So, because I used to be quite athletic, doing marathons and gymnasts and all of that. So I had a greater muscle mass, and I always said I was going to try to keep my core as strong as what I had back then. And literally, you can just when increasing your basic metabolic rate, right? It helps you to use up some of the calories that you're taking in.
So let's talk about the core for a second. A lot of people don't realize that the core and the pelvis is the base of your stability and foundation, and we absolutely need to work those out.
Yeah. So many people do not realize that the pelvis is important. How many people actually do their Kegels? I don't think that very many, right? I don't know if we can go in that direction, or I don't think, I think but ED, I kind of feel like they're giving you pills and things, but it's about circulation. So if your nitric oxide isn't good and you don't have good pelvic strength and your muscle mass deteriorates, yeah, it's not going to be as good. So you need to work those muscles out, keep your circulation, and your stability, and that's where your core starts. So if you can't do it and you've already lost it, you get a jump start with Emsella, which is a device, and you can jump start with Emsculpt, which is a device to get your core back and engaged. I had a lady today who she's lean, she's fit, she's athletic, and she comes in to get the Emsculpt because she doesn't always have time, and she does her Pilates, so she works out. But if like she had to do some traveling, she was traveling back and forth, long flights, not able to get on her Pilates, and her back was going to start to ache. But she knew if she did her core, and especially with the Emsculpt, gave her that little edge, she knows her back's not going to go out. So she comes in and does a little maintenance. So if you can just keep your core intact, it's going to save your back.
I want to talk about those two things. So let's start with Emsculpt right now, and the importance of that at your location.
Well, I call it my secret weapon to longevity.
There we go.
Because people just don't think about it. So by the time they come in, they're already behind the 8 ball, right? So yes, you can work out, you can train, and you need to work out with a personal trainer or on your own and do all those things. But if you're already behind the 8 ball and you want to gain that back, this is your edge. Or if you have it and you don't want to lose it, then you just come and do maintenance. But it's technology that is actually revolutionized, because I think that it's an anti-aging. You keep your muscles up, you keep your metabolism up, you keep your waist size down, you get to enjoy the food that you want to enjoy, you save your knees because you're not heavy, and the thing is that it also reduces...
It's not an impact. There's no impact on your knees or your joints or anything. So you're saving that and you're still getting the same workout, if you would.
Oh yeah, you're doing 20,000 crunches in 30 minutes at an intensity greater than you could ever produce. That's actually building muscle. So when you go do your workout, you can feel the difference. So the same woman, she says when she does her Pilates, she feels like nothing's happening with her core. She says she's sore everywhere else, but her core is not sore because her core is strong. And that's where you want to maintain it. And that is youth right there.
And how long is a session generally?
30 minutes.
30 minutes. And is more than that too much?
No, so you can do it every 2 to 3 days.
Okay.
Yeah. So some like bodybuilders, they tend to come in because they're doing competition and they want to get the muscles lean, and it also helps with the visceral fat, which is the unhealthy fat in the abdomen. So you don't want to have that kind of fat.
And the device itself, describe the device itself to us and what it does to your body.
So the technology is based like MRI, which is, and then it's a magnet, and so it has a big paddle, and this paddle you put on the muscle part that you want to help build back or recover. So it's great for injuries. So football players, anybody who has some kind of muscular injury or after surgery, this is great if you have atrophy. So you put it on as a flat paddle that you put over the abdomen, and then I gradually increase the intensity only to what your muscle can tolerate. Usually, after the second session you can get to 100%, but most people can't get to 100% initially. And you put that paddle over the abdomen, it contracts. So it's just a contraction, but an intensity. Or you put it over your glutes, or there's a smaller paddle you can put over the biceps, the triceps, the forearms, the calves. So it's great for where, if you had just had knee surgery and you haven't worked out and you didn't do any maintenance on your quads, and the quads is what's going to save that knee and support the knee. If you have knees that are giving out, or knees that are weak, or knees that are sore, you want to build up your quads. So start doing those. If you want to get a jump start, then you can use the Emsculpt. I had a gentleman who was doing yoga forever, and then he came and he was doing the Emsculpt, and then he said, I could never do the handstands. And then he said, I don't know, all of a sudden I was in my class and I just my head handstand. He said, I don't know what happened. I said, that was the core just working there. You got it engaged, and now it's strong enough.
When you're talking about knees, I saw you looking directly at my knees. So yeah, use a little bit of that. Give me 2 paddles. I'll take 2, please. So and what's the other machine that you mentioned?
Oh, Sella. So it's the same technology, but it's hard to put paddles on the intimate area. So you sit on it. So it's a chair. So the same thing. So you're sitting on it. The magnet contracts and it creates the kegels. So it's 11,000 kegels in 28 minutes at an intensity also greater than you can ever produce. Yeah, you'll feel it, but you're not sore afterwards. So the amazing thing about this machine is that, you know, when you work out and then you can't stand up and you have that, oh, I'm so sore, I can't, and then people come in and go, I'm so sore, I worked out on my abs, I don't know why I did that before I came in, I'm so sore. And then after they do the machine, they go, oh, I feel better. It's because it has a phase to push the lactic acid out. So a lot of people don't enough, you know, they're not hydrated enough, they don't move enough, and they don't do the slow recovery to move the lactic acid out. This machine forces it out so that you don't have that. So the Sella does this all by you just sitting there reading a book, and now you've done your kegels, and now you're stronger, better intimacy, you know, so that's better orgasms, better muscle strength, and then it helps with bladder control. Then you don't wake up in the middle of the night anymore. So yeah, so quality of life. That's what the whole thing is going on about here.
That's why you're here. You're here for to improve the quality of our life, to improve the quality of everything. You mentioned sex, better orgasms, better.
Right.
So you can actually help if someone comes in with sexual dysfunction. You can help with that.
I mean, in a way, yes. It's not. Let's just put it, it's not FDA cleared for that, but let's just say that is a result that we frequently see.
Okay. All right, well, good. One of our listeners has a question similar in some way to that, and I'll see how much of that you can get to. But I'm fascinated by these numbers. One of the tests you do is, can you get off the floor and stand without using your hands? And that's a balance test. Tell us about that.
Okay, well, no, that one's the strength test. So
excuse me, the strength test.
Yeah. So that one I routinely do that to check myself because I know my core is not as good as when I was a gymnast, and I wish it still was, but I know that if I can get down on the floor without using my hands and then get up without using my hands, I'm good. My balance is going to be good. I'm good. So I think that is a key one that I like to test and people should do to check that they have good strength. Another one is simple. But hard to do is just balancing on one foot. You can put your arms across your chest or wherever you want, but with your eyes closed. And if you can do it for greater than 30 seconds, then your age, biological age, could be younger than 30. If you do it for just 5 seconds, your age is about 65. So it's harder than you think. And then I don't have them all memorized, but there's different ones with eyes open and all of that. But generally I just use that 30 seconds. So I always practice trying to keep my eyes closed, balance for 30 seconds so I can because my goal is to have everybody's quality of life to maintain at age 30. That's my goal.
So when you leave today, I'm going to try and do it. Maybe crack my head open here as I fall over after 10 seconds or whatever. I love that. So how old are you according to your body? If you do it for 5 seconds at 65 years old, 10 seconds, 55, 15 seconds, 45, and you say it is harder than it sounds.
Oh, yes. Much harder. So I was getting a little depressed, I have to say, because I was like, oh, I'm not as young as I think. And so then I started doing all the young people in the year, and they couldn't hit 30, and they were under 30. And I was like, oh, they're biological age because they are not eating that healthy, right? So their cells not functioning, their brain, what's going on with their brain, right? So, yeah.
In a deeper and more, I want to get kind of into the weeds with you.
Yeah.
And have you noticed, and you've been practicing medicine for a long time, have you noticed that our society in general is getting weaker, physically weaker, because maybe instead of climbing trees and going out and running and playing tag and things like that, the kids are now in front of a computer or on their cell phones all the time. Is this something that you've absolutely noticed?
Yes,
All right.
100%. Because I see it going across. I mean, there's many countries that like to copy us, and I have noticed when they do copy us that they have become obese, they have diabetes, more heart disease. So we are a very unhealthy society, unfortunately. And I think I hadn't thought about it specifically that way, but I think you're right. It's movement, and I think people just need to move. But when you do move and use your muscles, people don't realize, I have to relate. Most of the things that I've done is basically what I've seen in the ER, right? So when I set up my office, people were complaining that golden years are not golden. They're aching, they have pain, and then that they're leaking urine. They were too embarrassed to tell anyone. And then we have to put these signs up about people. These are all fall risk. So everybody, they're falling. So I mean, how can you live your life if you're a risk for falling? And then people are using walkers and canes, and they can't move around, right? So we want to prevent that and get a better quality of life. And we are having this convenience food, which is not nutrient dense, and so eating things that are not nutritious, sitting around and not moving, that's not great. So all of this is just trying to help people to understand you need to move and use your muscles, because I'll do a CAT scan and look at the brain sizes, and people's brains shrink. People don't realize that. So you want to maintain that. So using your muscles actually also helps to keep the size of your brain, with also your hormones, your bone density. There's so many things that the muscles involved in, and besides just looking good and having power strength, it's an organ that's helping you function fully.
And maybe helping prevent early onset dementia, early onset Alzheimer's.
Yeah.
As our brain shrinks.
Yes.
I do want to remind our listeners that on October 24th, you can join Dr. Wong at her office at 255 Thalia from 5:30 to 7:30. It's much like this, only kind of personal face-to-face, an enlightening talk on the secret to longevity. What can we expect when we do?
So I just want to give an opportunity for people to come in, take a look, and speak with me, and then I want to just give them my specifics about what longevity and why what I set up in my office is basically focused on that. I have seen people who work out, but yet they don't look that healthy, right? Well, so that might be a nutrition, or it could be a genetic factor, it could be a cellular factor, it could be a gut issue. So there are other factors to it. If you do the 4 pillars and you're still not there are things that need to be investigated to look at, right?
Valuable, and that starts at 5:30. There's going to be a presentation on the longevity at around 6 o'clock, and then at 6:45 a question and answer session. I'll look forward to that. I do look forward to some questions that listeners have sent in, and I'm going to remind our listeners again, she hasn't had, as she answers these, she hasn't had a chance to examine any of these people, so it's really just kind of a general sense. So no matter what the answers are, check with your own doctor, right?
Yep.
Okay. So first question is from a 58-year-old female who asks, should I be worried about spotting or bleeding after menopause?
So obviously I think most people know when you spot or bleed after menopause, that means at least a year after your last period, that's not normal. Okay. So there are bad things and not so bad things associated with that. So simple things could be an infection, there could be a polyp, things like that. But you need to go see your OBGYN, get an exam, have it investigated. I mean, the most serious things that I think people are thinking about, it could be cancer too. So you never know, but it's something that can be investigated, and it could be something simple that it's an infection and it just needs to be taken care of.
So we are suggesting to that 58-year-old female, thank you for asking that question, by the way, to go check it out with your own doctor. Next question is from a 25-year-old female. Can I still get pregnant while on my period?
Well, okay, that's kind of a yes-no kind of thing. So, if your periods are regular, a certain amount of time, If you have short periods, you have irregular periods, so it depends. So generally what's happening with your hormones, they're fluctuating, right? And they're getting things ready or they're getting rid of things, and then you're going to ovulate. So during your period, the hormones have now allowed it so that the lining of the uterus is all sloughing off. And so generally you can't get pregnant because there's no place for the embryo to nest, right? But you could ovulate. So, but typically it's not going to ovulate while you're bleeding because that's the end of the cycle. But if you have an irregular period, that's, you know, who knows what's going on. And then if you have a short period, and let's say you have intercourse towards the end, and that's also closer to where you're going to ovulate. So let's say that it's towards the end, you're kind of spotting, but you had intercourse. And then you ovulate. But that sperm likes to hang out.
Okay.
So it'll hang out for a few days and wait, and then guess what? It met up with the egg. So that could be a yes answer.
Okay.
Just depends.
So it really just depends on the individual.
Well, yeah, your cycles, where it is, where you did that. Did you ovulate? Do you ovulate in the middle? I mean,
And sperm can live for several days?
Several days, yes. Yeah, so better to do it at the middle, at the beginning of the period,
Right.
because unlikely then.
Okay. Thank you for that. Next and final question is a 48-year-old female asking a question about her 54-year-old husband. His ejaculate is much thicker and of considerably less volume than years past. Is this a normal sign of aging or something more serious?
Well, all right. So there are things that come up. So if the question would be, does he have any comorbidities? Is he on any medication? Does he stay hydrated? Is he overweight? Is he sedentary? Is he, losing muscle mass? With losing muscle mass, you're losing testosterone. So then those would be the things that would be making it thicker, a little clumpier, right? So you don't have to be older for that to happen. That could be in a 30-year-old too, right? So if you have all these comorbidities and you're taking these medications and you're not hydrating and you're not eating well and you're losing your muscle mass and all those things, yeah, it could be. Because generally a healthy body and a man, that generally, it does diminish as you lose some of your hormones, but if you're maintaining, you're not gonna see a difference. But there could be a lot of factors in there.
Thank you for that. And once again, I'll remind our audience that, yeah, she hasn't had a chance to examine any of these people, so I love the fact that you're texting in and asking questions, but always check with your doctor as well. Dr. Anita Wong, we will join you not only next Monday, but we're going to join you October 24th at your office on 255 Thalia from 5:30 to 7:30 for a great event, which I'm hoping the community gets involved in and gets themselves over there because they can learn a lot in a face-to-face conversation with you, as I do every Monday. I'm delighted that there is.
Oh, it's an honor to be here. It's such a joy.
If you missed any portion of this conversation, it'll be up a little bit later on our website, voiceoflaguna.com. I'll put down the podcast. You've got your own page, by the way, on the website.
Yeah,
nothing's too good for you.
That's why I love you.
Dr.
Come on.
Anita Wong, thank you so very much. We look forward to seeing you.